So this video has to do with stabilizing through use of your inner thigh muscle, your muscles, your adductors, which of course tie into countering what we're doing when we twist from our torso and sit back in the hip here. Especially as we come up out of that, we want to make sure that we can anchor on the inside, because if you're going into that and you go too much to the one side, so this tends to happen more on the stronger side, although it can happen on the weaker side, depending on what's going on in your body. But if we twist here and we sit back, we hinge and sit into the hip here, but if we're over twisting here, or if we just naturally gravitate towards that side too much, what's gonna happen is either the hip is gonna kick out here, which is usually what happens when it's the weaker side, but when it's the stronger side, what tends to happen is, you can't see it in the frame here, but your big toe knuckle might start to lift up and you might actually start to roll your ankle. Or to counter that, you might find that you're toeing out, so that keeps your foot at least in line with that that excessive weight shift to that side. So that's kind of a compensation to not roll the ankle. Maybe is to actually toe out and kind of glide that way. Either way, in any of those scenarios, you might be finding that you're getting some knee pain on that side. And that's because you're not anchoring the inner thigh, which ties in with the VMO, which is part of your inner quadriceps muscle, and it ties in with stability or stabilization in the foot, ankle, and as well as the knee, hip, the whole body, but it does tend to affect the knee more, even if it's your stronger side, because of that lack of stability and that imbalance there. So if you're getting knee pain, maybe it's your stronger side, or maybe your hip's kicking out, maybe it's your weaker side. Either way, you want to be aware of the fact that you need to do those first few things, is twist here, sit back here, and then keep, especially as you come out of that, but even down at the bottom, start to pull in that inner thigh. So if you don't have those things and you pull in, that's when your knee might be kicking in like this and you're kind of collapsing that way, which can also cause knee pain, but usually it's a little different, okay? So we're kind of here, there, I'm engaging, I'm gonna feel as I twist and sit in my hip, I should feel I'm grounding through my heel, or at least the outer portion of the heel. And then here, when I pull in and push the inside of the big toe knuckle, that tension between the two is gonna really help stabilize me, help me feel grounded and balanced. And then as I come up, I'm increasing the tension up here and in through my core, and maybe up through my scapula here, and up in the arms, okay? So I kind of sit down on my hip and kind of flow up through, but I got to root and ground to have the control and the leverage to do that. So as I'm walking, I'm kind of engaging back into my hip, heel, inner thigh, big toe knuckle, back up here, same thing, hip, twisting here, hip, heel, pull in here, start to, inner thigh, big toe knuckle, no knee pain, and no hip kicking out there, right? So keeping that tucked. If you have a really tough time with that hip part, what you can do is you can just kind of set up like this in a kind of a wide position and start to kind of shift and to think about that inner thigh kind of pulling your weight over top, not to lean, but to lift up tall, straighten everything out. So it's kind of like this pendulum kind of swing, but you're gonna think about pulling yourself over with your inner thigh and not letting that hip kick out. Pulling over the inner thigh, not letting the hip kick out. Keeping more tension, butts and guts, and balance between the outer hip and the inner thigh on each side, and not rolling through your foot or ankle or collapsing in through your knee. And it should be nice and smooth, and you can transition that into your walking as well.